people sometimes have this misconception that for me to successfully complete an addiction treatment, I have to be completely abstinent from drugs. For some people, this is a very, very tall order. It's a very big thing to be able to achieve that. So sometimes we say, you know what, we can take baby steps at a time. You know, you don't have to do it all at once.
Harm reduction was really in New York State, was born out of the HIV and AIDS epidemic and syringe exchange programs and the harm reduction initiative in the early 1990s. When you get in your car and you wear a seatbelt, that's considered harm reduction. If you're drinking Diet Pepsi, that's harm reduction. For people who use drugs, a needle exchange is harm reduction. Narcan is harm reduction. Giving out condoms is harm reduction. Safe injection techniques, giving people bleach kits and wound care kits. Buprenorphine bridges. We are going to celebrate any small positive step at reducing a negative risk or a negative consequence to a behavior.
If there's anything we can do to meet them where they are, to walk them back to where they need to be, there's nothing wrong with that.
We're going to meet you where you're at. You tell us what we can do to help you to live a safer and healthier life, and most importantly, keep people alive.
So harm reduction is, if they're going to do it anyway, let me show you a healthy way of doing it where it won't harm you in the long run.
It's only very recently that anyone started to take more of a harm reduction approach. And it's really only very recently that treatment has really sort of started to take with me.
Harm reduction, I think, is important because we can't say this is one set way that every single person is going to be able to get through this addiction.
It's the community coming together and saying, we value your life and we value it without judgment, whether you're using drugs or not.
So I give patients Narcan and naloxone, and why am I doing that? Some people are against it. You're enabling them. We don't say because somebody has an allergy to peanut butter and they keep eating something that has peanut butter in it, we're not going to give them EpiPen, right? Why is it different for this patient?
I am so grateful for Narcan. It saved my son, and I know of other people also that it has saved, and it's the best thing I've ever done. There was times when I would actually just curl up on the floor and sleep next to him if he was on my couch, because the fear of your child dying is there all the time. I felt like I had no power and no control, and I didn't. But the Narcan gave me something. It gave me some small amount of something that I could do when you're powerless in a situation.
Hi, Kevin. My name is Mary, and my son is Brandon Harrison, and Jordan is his counselor. And I came to you, and you gave me the Narcan kit. And on Sunday, Brandon overdosed on heroin, and he died, and he was revived by your Narcan. So I just wanted to say thank you for what you do, and thank you for educating people with Narcan, because if it wasn't for your Narcan kit, my son would be dead today. So I just wanted to let you know that I really appreciate you guys and what you do. And so thank you.
Basically what happened is I was really, really sick one day. I was going through withdrawals really, really bad. I had no money. I was trying to sell things, and I actually got a text message from the person I would get heroin from, and he told me that he had tester sample bags that he wanted me to try. So when I went there, I ended up doing just 2 of the bags, which is like a little amount compared to what I'm used to. And then basically I ended up overdosing right on the side of the road, right where I shot him up. Needle still in the arm, whole nine. Instant. Like I shot up and that was it. Basically they Narcaned me a few times, which brought me back. But when they got there, it was complete dead on arrival. Like I was definitely out. I woke up covered in glass because they had to bash the window out.
We're talking we have minutes, precious minutes to spare, where oftentimes we don't have time for paramedics or police or fire department to get there to reverse an opioid overdose.
You're giving somebody a chance at living, that's what it boils down to. It doesn't boil down to whether or not they're going to use again. It's whether or not the person gets the chance to possibly not use again.
So when I give you Narcan, it's because I'm not saying go ahead and use, it's fine. I'm saying if it happens that you use and somebody is around you, or you know that something is happening to you, you can quickly inject it, and that saves a lot of lives.
I don't think Narcan enables or creates any new drug use, but what I do think is it definitely saves people from dying. It has one specific purpose, and that's to reverse an opioid overdose. And other than that, there's no interactions with the body. So the way that we look at this is, if we saturate the market and get this out there everywhere and have people that know how to use it everywhere, a lot less people are going to die.
I had a phone call that my son was in the ER. When I got there, I found out that he was there to a drug overdose. What unfolded before getting there is that he went down unable to breathe, started turning color. Officer on scene, first responder, shows up and has Narcan in his hand and had asked multiple times to the people that were with him that was he a possible drug user, and they said no repeatedly. So Narcan wasn't given. The stigma is something I think a part of why my son didn't get Narcan and went 25 minutes without oxygen to the brain. I can't deny that when Narcan first hit police cars and ambulances, I was that person that didn't understand why we were doing that didn't belong there. I learned the hard way as a parent when my child should have had Narcan and didn't get it, that it makes all the difference between life and death. I've saved a girl in Canastota, New York. I watched her take 4 vials of Narcan to bring her back. I was doing chest compressions when I found her in the gas station until first responders were able to get there. I physically saw Narcan make all the difference in the world. Everybody carrying it, having it there that much sooner for somebody that's in need can save not just the life of that person, but save the family, the parents, the pain of not having their child anymore. This is my son's ashes. He's with me every single day. It's a way just to keep him close, because quite frankly, I miss him daily.
We lost over 70,000 people last year to a drug overdose in this country. That's one person every 12 minutes. People are dying in every county, county by county, state by state, rural, suburban, urban areas. It does not matter, it doesn't discriminate. People are dying, and that's what harm reduction's about in this moment, in this crisis that we're currently in.
You talk about needle exchange programs. I know no matter what I do, some people are still going to use these drugs. They're going to be shooting these drugs. Can I figure out a way to make them safely inject these drugs, so to prevent them from having serious medical consequences of the IV drug use, heart infection, endocarditis, HIV infection, hepatitis C infection? I can give them clean needles, and they know they have access to clean needles when they want to use.
Oh, I use the service of the van to keep myself safe and clean. This is the advantage of this van, coming around. I mean, HIV is popular. When you use a syringe, you can change it. You know what I mean? You don't have to use the same one over and over again. And people do that. A lot of people do that.
I've shared needles before in the past, and it's just not safe for me, and I know that it's not.
How many 29s do you need?
Can I get 30, please?
Yes.
I don't share needles now. I know how to take them, use them, and get rid of them in the containers they give us.
It's Safe Sharps disposal and Safe Sharps access. So people can come in and access clean syringes, clean needles. They can get education on clean injection.
I've gone as far as picking up a needle off the ground and using it because I needed to get well. Out of a pile of dirty syringes. I mean, talk about playing Russian roulette, that's crazy. And so, this is a blessing because I'm not the only one that does that kind of stuff, you know what I mean? I know I'm not crazy alone.
I mean, there were times that I was reusing syringes, rusty syringes that were breaking off in my arm.
People had blew out their veins, ran through their veins, would jab themselves.
So sometimes I'm using the same needle 4 days in a row, and it's dull, and I have to puncture it through, and that causes more pain, more potential for abscesses.
I had a friend who took me to the syringe exchange and showed me how it worked, and I stopped butchering myself.
This is where we come into giving an intervention and good vein insertion and giving good harm reduction techniques to where people won't not only harm themselves, but do it in a good way. Because after this life is over, we want people to be healthy.
Because I'm not giving up, then of course, I gotta maintain my health so that when I do get sober at some point, I'm not going to end up dying from some disease that I caught while I was in active addiction.
It's also a place where people can come and get access to on-site rapid testing for HIV and hepatitis C, linkage to care and treatment if they're ready, if that's what they're there for.
People that don't understand drug use and addiction, they look at these guys as being the enemy. And also that by making syringes readily available to the community, that it's almost okaying, drug use, which isn't the case at all.
But that doesn't mean I'm promoting them using drugs like that. I'm just trying to help them while they're trying to get treatment.
We're going to meet them where they're at. So it's all about understanding the reality that we're in and dealing on fact and not fear. So the fact is people are using drugs around us and they're dying around us, and they're not connected to services. A needle exchange is a life raft. It's a service to connect them. It's a safe place where they can come, and it's a place where we can connect them to all sorts of services, give them Narcan, make sure that they're healthy and staying alive.
MAT simply stands for medication-assisted treatment. It's a form of harm reduction treatment. MAT is replacement of a substance to which a patient is dependent, which is potentially harmful and more commonly short-acting, replaced by a longer-acting treatment with similar pharmacological properties. Buprenorphine is an opioid itself, but we refer to it as a partial agonist opioid. The reason why most people use drugs like opioids on a regular, almost daily basis is because they're trying to prevent withdrawal symptoms and to eliminate their cravings. That's exactly what buprenorphine helps with. Methadone is a full agonist opioid. It also helps with withdrawal symptoms and cravings.
I needed medication-assisted therapies for a long time, and I would get pushback and have arguments going to 12-step meetings where people would say you're not really in recovery. And I'd have these drawn-out debates with people, and it steered me away from 12-step meetings. But I know people who go to 12-step meetings and that saved their lives. So I'm a total advocate for that.
It depends on the stage of addiction where you are. It depends on the degree of damage that's already done to the brain. Sometimes the brain is already so irreversibly damaged that it's going to demand this drug for you to function. I said earlier on, the kind of issues that make people start doing drugs is not what makes them continue to do drugs. Now, most people in the later years of their lives, they're using drugs to feel normal.
I don't get high anymore off heroin. I just need it to be normal.
If they don't have the drug, they're going to feel so sick, they're going to be in so much pain and discomfort, nothing else is going to matter.
The hardest part is you, at the end of the day, could know that you don't want to use anymore. But when I'm waking up in withdrawals, I am throwing up, sweating, crying, sneezing, coughing, and want to die. That's the hardest transition to me, is that early recovery beginning. So the thing with Suboxone and Methadone is they help you with the physical side, which, like I said about the Narcan, it kind of gives you a chance to move in the direction of recovery.
There's been tons of studies that have shown the superiority of this treatment over abstinence-based treatment in terms of abstinence from drugs or return to drug use, in terms of retention in treatment, in terms of being able to return to work, in terms of serious medical complications of drug use, in terms of criminality, in terms of healthcare costs. In so many levels, this treatment has been shown to be safe and effective.
But you can take the heroin out of my system and put Suboxone in me any day, but I'm still the same person. You take the drugs away from the junkie, you still got the junkie. There's so much work that needs to be done inside. I have rerouted my brain to thinking, every day I go and get high. Every day I find money to get high. Every day I take a trip to meet the dealers. Every day is revolved around this. And then all of a sudden you hand me a maintenance drug, and all of a sudden that can't be it.
So we're not just dispensing medications to patients. Patients with us are really engaged in treatment. There's so many aspects of it. So I'm talking about patients engaging in individual psychotherapy, group psychotherapy, drug counseling, learning new skills, relapse prevention skills, harm reduction skills. So a lot of times at the initiation of treatment, patients are required to come here as frequently as possible, sometimes every day, until they're more stable and can spread things out a little more. We treat the addiction part, we treat mental health issues, we address medical issues, but very closely monitor treatment is what we do here.
So those things are not the cure. It's not like you get handed Suboxone or Methadone and all of a sudden, like, you're 10 years clean in a blink of an eye. Like, there's a lot of mental things involved in it. That's where it mostly is. But that initial transition into going from active use to recovery, I think it's just a necessity.
What studies have shown is that the neurochemical changes of the brain starts showing significant reversal after 1 year. So if a patient insists they want to come off, we will recommend they at least stay on it for 1 year. Then after that, we slowly taper them off the drug as tolerated by the patient. But basically, it's patient's choice. If we have evidence that this treatment saves lives, this treatment helps patient to be able to function, this treatment helps patient to be able to move away from illicit drug use, why not?
The DARE program, they tell you, like, this is what a heroin addict looks like. Heroin addicts are monsters. You use drugs, you're a monster. You're this, you're that. This is what drugs look like. When really, drugs don't look like anything. Drugs don't care what race you are, what gender you are, how you identify, who you are, how old you are. It doesn't matter. It doesn't matter if you have money, don't have money. Drugs affect so many different people, and that's where the stigma was the worst for me, is that it's really hard to admit that I'm a heroin addict or think that I'm a problem when I associate heroin use with the stigma that you get in your head.
We learn it. I mean, it's something that we learn from the time that we're kids, that, you know, those are junkies, those are bad people.
The stigma makes it really easy to pigeonhole people, and when you can't have an honest discussion, it's so easy to fall back into that on both sides. And as a drug user, just to say, you know what, yeah, I'm just a stupid junkie, you know, yeah, that's me.
Fighting off that stigma was like the biggest hurdle for me to actually sustain my recovery and take the shame and the guilt out of my drug use and approach it as not a poor choice, not a moral failing, but a disease that I have that I need the treatment for that disease.
It's actually a brain disease.
People don't realize that this is not something we really choose to do, that it's a mental illness, really. It's, you know, addiction is something that you just can't get over in a day.
There's also a genetic component to addiction. About 50% of the risk of addiction is genetic, which means for some people, the day they're born, they already have half the risk of becoming addicted to a substance if they ever exposed to that substance. You could go to the emergency room for any form of pain and somebody prescribes you a pain medication. You could hang out with your friends when you were in college and somebody introduces you to alcohol. But for this subset of people, this starts a very negative cascade of reactions.
Two people can use the same amount of drugs or alcohol the same amount of times, and one person might get the disease and another person might not. So then all the groups of people that don't get the disease look at it like, well, I didn't get it, so this is their choice. Other people aren't like that. Whether it's trauma, whether it's hereditary reasons, doesn't have to be anything. We don't know what it is. It could be a mixture of a lot of things. So, but the stigma is, in my mind, the number one thing we have to fight. It's our biggest hurdle.
I think the stigma around drug use really prevents a lot of honest discussion.
You're going to get pushback against proven things that we can say, look, this worked in other areas, it's working here, but people don't, the stigma is so thick in certain areas, people won't want to hear the data. They're just going to say, no, it's going to enable drug use.
The reasons I do this is because people need to understand that the stigma is killing our children. That the lack of understanding, the lack of compassion, the lack of knowledge is killing our children. We're not going to arrest our way out of this. We need to be educated. So learning what I've learned, keeping it to myself, and not doing anything to help others isn't any better than the people that were there denied they knew my son used drugs.
If anybody asks me why my daughter passed away, I tell them because maybe they're struggling, maybe somebody that they love is struggling. I wish that we had included the reason that she had passed in her obituary, because maybe it would have helped somebody.
Drug users develop this whole other world that they live in because of that stigma. You know, drug users have this whole other language that we've built, this whole little sort of society that we've had to build underneath the society that we live in. We've sort of learned to live in this sort of underworld that we've created. You know, the prostitution, the starvation, you know, the living in abandoned houses. You know, those are the invisible casualties of drug use. Because of that stigma that sort of outcasts drug users.
Stigma is a very dangerous thing in addiction, very dangerous in the sense that, you know, addiction is a chronic progressive disease, and just like any other chronic progressive disease or a chronic relapsing disease, the earlier you can get into treatment, the better off you are at the end. So when patients are trying to get help, when patients are trying to reach out for treatment and they feel like they're not being treated right.
I got clients that rather die on the streets than to go to the hospital and be treated like shit because they already feel bad.
So if they try to get into treatment at that hour and they're not able to do it because somebody looks at them in the emergency department and say, "Oh, you use cocaine? Oh, well, go sit over there." And they talk to them like they don't matter. Guess what? They're going to walk out of the emergency room and they're going to go use again. A lot of people who die from overdose die when they're using alone. And the reason why they're using alone is because they want to hide their addiction because of stigma. The stigma is everywhere. Every time you hear people say those people, these people, that is the worst thing we can do for addiction. It limits them from accessing treatment, it limits them from engaging in treatment, and it limits them from succeeding in treatment.